That's right, and this is why all of our discussions today are so frustrating. There are a lot of diseases out there for which we don't have a cure, we don't have a treatment, we don't have prevention, and we really struggle with those and we need more research. And yes, we need more research when it comes to opioids as well. But we actually know what works. And to your question earlier, Lenny, about why has this been so different from any other public health crisis, there's one word: stigma. There are myths and misconceptions around the disease of addiction that's very different from other illnesses. I hear, for example, in Baltimore, you had mentioned that we've been putting out our antidote medication, Narcan or naloxone. I wrote a blanket prescription for this medication to every single one of our 620,000 residents because everyone should be able to save a life. And yet I hear people all the time say, well, why give this medication to people? Isn't that just going to make them use more drugs? Would you ever say to someone who is dying from a peanut allergy, I'm sorry, I'm not going to give you an EpiPen because it might make you eat more peanuts next time? Right? We don't hear that. Naloxone works. It's immediately life-saving. It's non-addictive. It's safe. And we have to save someone's life today to get them into treatment tomorrow. So that's one thing that works. And yet we don't have nearly enough of it because of stigma. There's also huge stigma around treatment. We don't say to someone with diabetes, well, why are you still on insulin? Why can't you get off of your insulin? And isn't lifestyle changes, shouldn't that be enough? And yet we make those assumptions about people with the disease of addiction all the time.
And in regard to Suboxone and methadone.
That's right. When actually the science is clear that medication-assisted treatment with methadone, buprenorphine, combined with psychosocial counseling are what works for the treatment of addiction. And for so long, we have treated addiction as a moral failing, as a crime. I go back to what I think are Senator Markey's excellent points about a whole generation of people who we have to apologize to. In Baltimore City, I've had our residents at community forums come up to me and say, I don't understand why suddenly the opioid epidemic is a public health crisis. Why is it an emergency when it's been a state of emergency my entire life? Because it was poor minorities in inner cities who had this illness, and therefore it was seen as a choice and a moral failing. Therefore, if you end up in jail or dead, it's your fault. I'm glad that we're now seeing it as a disease, but then we need to treat it as any other disease and devote the resources that are necessary to fight it.
And very quickly, how many people, what percentage of the people who need it get treatment?
The Surgeon General's report said that it's about 1 in 10 people. 1 in 10 people with the disease of addiction are able to get the help that they need. Now, what other disease would we find that to be acceptable, right? Would we find it acceptable if only 1 in 10 people with cancer can get chemotherapy?